The Y-balance test, or modified star excursion balance test, is a valid, reliable, and practical test of dynamic balance. The ability to maintain balance during movement is needed to perform many activities of daily living. Contraindications include injury or condition that prevents the client from completing the test safely, pain-free, and with proper technique, or a history of falls. Place 3 strips of masking tape approximately 1 meter in length on the floor. The forward anterior piece of tape is placed on the floor with 2 other pieces of tape at 135-degree angles. Briefly explain the purpose of the test and describe the protocol in full, including test termination criteria. Then demonstrate proper technique before beginning the test with the client. Have the client remove their shoes and socks, stand with hands on hips, and place the heel of their standing foot at the intersection of the 3 lines. The floor surface should be flat and stable. Stand near the client and be prepared to spot if needed. Clients are allowed 4 practice trials in each of the 3 directions on each leg. Clients begin in a single leg stance, instructed to reach out with the free leg as far as possible and gently tap the floor without losing form, then return to double leg stance. After the 3 practice trials are done, the client performs 3 further trials in each direction: anterior, posterolateral, and posteromedial, and the most distal portion of the reaching foot for each trial is marked on the tape with a felt pen. 10-second recovery should be given between each individual trial. The entire process is then repeated with the opposite leg. If any of the following errors occur, the trial is discarded and the client is instructed to repeat the trial. Test termination includes the inability to maintain single limb stance. For example, heel comes off the floor, hands come off hips, excessive trunk movement, and moving leg touches the ground. As well, if the client makes a heavy touch with the free moving leg, rests the foot on the ground instead of tapping, does not make contact with the tape during the attempt, or is unable to return to the starting position under control. The maximal reach distances are measured to the nearest 0.5 cm from the intersect of the 3 pieces of tape, i.e. the middle of the Y, to the furthest felt pen mark for each leg and each reach distance. Limb length is used to normalize scores. This is measured from the anterior superior iliac spine to the center of the medial malleolus when the client is lying supine. Determine the mean score of the trials from each side. Remember that scores should be expressed as a percentage of limb length. Reach distance divided by limb length times 100.